I feel like a lot of people are a little nervous when they first hear about the idea of operating an ankle. It hasn't technically been our space. You know, people say they're not ortho or ankle doctors, but we offer treatment in this space all the time. So it doesn't take much effort to really become an expert. Tibial nerve stimulation is what we do, you know, so understanding the anatomy a little bit more clearly is well within our realm of capabilities. Getting into the lab was great. It was nice to learn the anatomy, how simple it is, how reproducible it is, how easy it is to find the tibial nerve. Small incision and entry to basically the bundle packet is seamless. You do it over and over again and you forget, you know, why you thought this could be difficult in the first place. At the end of the day, we love as surgeons to get optimized outcomes. We love to position our neuromodulation devices so patients get the best outcomes. And a small incision with reproducible anatomy that can allow the patient to get that response is well worth a little extra time, you know, in a skills lab to learn how to do it. The anatomy, the landmarks, they're all reproducible. The positioning of the patient, the technique to make an incision and cut down and find the tibial nerve packet, very easy. And patients tolerate it so well. It's quick, and then it's just skin closure, which we're all good at.